My name is Dr. Kerry Yurkio, and today we're talking about what can you expect from the first few weeks of chiropractic care. I guess that depends on the condition you're in, but this week, today on Monday, we've had a few people come in saying, how come I felt that way after the first few adjustments? Normally what happens is when we have a bone out of place in the spine, and if it's been out of place for quite some time, we want to realign that spot. As we do our adjustments to realign it, the way you can think about it is it's kind of rusty in there. There's some degeneration. Sometimes the tissues are damaged a bit, the discs are degenerating, and we've got to get the bones realigned so the area can heal. So when we make our first few adjustments, usually the patient feels better. When we move the bone, it takes the pressure off the nerve, and immediately there's a sense of relief, and that's fantastic. But we also want to warn our patients that by moving the bones into a better place, the body has to start a healing process to get the muscles and ligaments stronger and the discs regenerated. The first step in that regeneration, that healing process, is inflammation. The body always swells in order to provide nutrients to the area so it can rebuild. That inflammation can be tender, can be sore, and in some cases you can actually feel worse. So what I find for my patients is we do the adjustment, immediately they feel better, but during that week or even the next week, they could wake up the next day feeling more sore and wondering, what's happened? Am I taking a step backward? Is there a problem? And there isn't, but the body's swelling, trying to heal, and sometimes that inflammation can even irritate the nerves a bit. So if you go to see the chiropractor and you're feeling like you're making 2 steps forward and then 1 step back, that's normal, but it's also good to ask the chiropractor exactly what's going on with your condition so that you know what to expect in the weeks and the months to come.